So if somebody, a space alien, came down and said, Mr. Gates, you understand everything, how do you explain the fact that the richest country on Earth that spends per capita maybe 2 to 3 times as much on healthcare as all the other rich countries in the world seems to be kind of at the bottom of the pile of the advanced countries in the world in being able to handle this pandemic? What would be your answer?
Well, it took a number of mistakes, and I wouldn't have predicted that we would do so poorly. Our Center for Disease Control is the best group of epidemiologists in the world. In fact, everyone relies on them. They're part of our polio eradication work. They're very embedded at WHO headquarters. They're very good, but a variety of early missteps by the U.S. And then the political atmosphere meant that we didn't get our testing going. It's nonsense that any sort of travel ban we did was at all beneficial. That doesn't pass the common sense test in terms of the waves of people that U.S. citizens that were allowed to keep coming in. And now, we've executed our lockdowns less nationwide and with less fidelity than other countries. So we're paying a pretty dramatic price, and not just in deaths. We also pay it in terms of the economic toll, which is up in the trillions.
And so when you look at the charts, the United States and Europe suffered about the same kind of curve, upward climb of infections and deaths. And then the Europeans start to go down and US starts to go down. But then we start to climb up again. And around that time, I remember you coming on this program and saying the lockdown has to be national. The only way this works is if it's a real national lockdown. Otherwise, with border travel among states, it's not going to mean anything. Was that the crucial mistake, that you had that much variation? And isn't the problem that there were parts of the country that felt like they had no infection, they had no outbreak?
Yeah, what's impressive is that Italy, France, Spain, who had a wave before us, managed, as they fell off, to keep even the parts of the country that hadn't had the intense epidemic from creating a second wave. And so it was pretty focal in all of those countries. And so if they'd fallen to the paradox that we did, which is that the regions that had had the least burden in the first wave were ripe for that second wave. So in the case of the United States, they opened up their bars. They didn't do much in the way of wearing masks. And so those areas became this second wave, not a rebound out of New York, New Jersey, but instead those regions. And so that's where Europe and the US are quite different. Our testing, of course, to this day, it's mind-blowing that because you can't get the federal government to improve the testing because they just want to say how great it is. I've said to them, look, have a CDC website that prioritizes who gets tested. That's trivial to do. They won't pay attention to that. I've said don't reimburse any test where the result goes back after 3 days. You're paying billions of dollars in this very inequitable way to get the most worthless test results of any country in the world. And you've created this incentive for the commercial guys to have long lines because you do not, you just want to waste government money. You pay as much for the late result as the timely result. No other country has the testing insanity because they won't talk about fixing it because they think they need to just keep acting like they've done a competent job.
So this seems to me to be the critical systemic problem that we have. When you look at Germany, they use the period of the lockdown to then put in place a good testing regime which is rapid, which then has some tracing element. And we just have not been able to do this. Can you explain to people very simply why a test result that comes back to you 3 days later is almost worthless, because you're really just testing whether somebody has COVID that minute, that second, right?
Yeah, your period of infectiousness can start a couple days before you would feel the symptoms to seek out a test and extend to about 4 days after. That's almost all of your infectiousness. So the value of a test is that when you get that result that you're positive, that then you quarantine yourself and you don't infect members of your household or other people that you know. Is every day that goes by, that peak of infectiousness is going down, down, down. And so by the third day, the value is maybe 20% of a timely result. Now, very wealthy people have access to these quick turnaround tests, or they get ahead in line, and they're getting more of those overall tests. And so, the one breakthrough we did, the foundation did get pushed through, is that instead of a health provider having to jam the swab to the super back of your nose, that you could just self-administer at the tip of your nose, and that's equally accurate and doesn't risk infecting the other person, and it can speed up the activity.
So at this point, what could be done to really substantially change the trajectory in the United States?
Well, the trajectory over time will go down because, we're learning that there's some protection from earlier exposure to other coronaviruses, and that's helping drive the numbers down. There's natural infection, particularly the people who move around a lot. They're disproportionately infected, and once they recover, they're taken out of that transmission pool. And then the vaccine will come along, maybe towards the end of the year, certainly within the first half of 2021. And if the first vaccines that get chosen are good at transmission blocking, you'll very quickly get up where the multiplication rate, instead of being above 1 and growing exponentially, will be below 1, and you'll have diving number of cases and just a few pockets left. So because of the innovation, the therapeutics will cut the death rate, and the vaccine will dramatically, once we roll it out, it'll cut the infection rate. So, by the end of 2021, the U.S., in terms of its own epidemic, will largely be through it. But in the meantime, trillions of economic damage and hundreds of thousands of lives lost.
What would be your message right now to the president, to governors? What can they do now? As you said, there is a natural cycle, but how can you get to a point where you are, because it seems to me you could differentiate risk in terms of the people, the population, in terms of the activities. Right now, nothing happens. I've people I know who have flown into the United States, and they say it's like no other country in the world. Nothing happens. You're told nothing. It's as if there is no COVID.
Well, because we're one of the most infected countries in the world, people coming here, on average, will reduce our infection rate. So it's not, now, the day will come when the U.S. has its act together, and that's partly why, to avoid reinfections, I'm spending a lot of time trying to make sure money for buying the vaccine for the developing countries is included in this relief bill. It'd be about $8 billion for therapeutics and vaccines, so less than 1% of the total. But that's the money that, more than any other, would save lives, strengthen our strategic position with our allies versus China, and allow us to not have these constant reinfection events that people like Australia or South Korea, who did a competent job, they still have Americans and others, when they come in, starting new chains of infection.